this video, we shall learn how to do a lumbar puncture for obtaining CSF sample for culture and other relevant investigations. Most of the steps which are done for CSF sampling are actually similar to blood culture. But an important point which needs to be remembered is that in the infants in which you are doing CSF sampling, those infants are generally sick, so we need to ensure that they are properly positioned and optimal care is given to them. Ideally, all cases of CSF sampling should be done under expert guidance.
Lumbar puncture is an invasive and skillful procedure. Thus, taking informed consent from the parents or guardian is very important. Requirements for the procedure are trolley, lumbar puncture tray containing cotton balls or gauze pieces, whole sheet or eye towel, 1 in number, 2 more towels, 2 bowls, 1 artery forceps, 3 sterile vials, 22 to 24 gauge spinal needle or disposable needles of 24 or 26 gauge, 2 in number, isopropyl alcohol as 70% solution, povidone iodine as 10% solution, sterile gown, mask and cap, 1 each, which has to be disposable, a pair of sterile gloves, vital signs monitor or pulse oximeter if available, resuscitation kit which should be checked before the procedure. It is preferable to have dedicated set of trays for the procedure of lumbar puncture in NICU, which have to be autoclaved before use. This not only makes the process simple and easy, but also ensures that sterility is maintained. For CSF sampling, we need 2 healthcare providers, 1 doctor and 1 nurse. The nurse should be well versed with the procedure. Always ensure that the resuscitation kit is available to you and is functioning well. First, wear mask and cap before washing your hands. Wash your hands as per the standard guidelines. After hand washing, wear a sterile gown. Then, wear a sterile pair of gloves. After the nurse has cut open the LP set, arrange the bowls and put cotton balls or gauze pieces into them. The nurse or the assistant will pour 70% isopropyl alcohol in one bowl and 10% povidone iodine into another. Ask her to drop 2 26 gauge disposable needles into the tray. In this video, we will demonstrate the use of disposable needles as spinal needles are not freely available in many health facilities. Connect the baby to vital signs monitor or pulse oximeter if not already connected, and see that the parameters show values in normal range. Once you have arranged the requisites, proceed with positioning of the baby. Positioning is one of the most important steps in the procedure of lumbar puncture. If proper positioning is not done, attempt to do lumbar puncture may be unsuccessful or traumatic. Lumbar puncture can also be done in sitting position. Here we describe the more commonly used supine position. First, turn the baby to one of the sides. Then gently apply pressure on the shoulders and the hips to bend the back and make the spine prominent. Flexing the hip to 90 degree only avoids undue abdominal compression. Take care to avoid direct flexion at the neck of the baby. After correctly positioning the baby, we come to the step of skin preparation. Apply isopropyl alcohol first, then povidone iodine, and finally isopropyl alcohol again. Apply them with friction. Remember, the swabs should be applied in circular motion from inside to outside, with the estimated point of needle prick as the center, finally to include the iliac crests. More importantly, ensure that each time you swab, you allow enough time for drying it in air before applying the next one. After disinfection of site, it has to be draped with sterile towels from below, slightly lifting the baby, and then from above. Thereafter, cover the back with a sterile whole sheet or eye towel so that only the area identified now remains uncovered through the hole. Remember not to cover the face of the baby. Now, hold the 26 gauge disposable needle by its hub between the thumb and index finger of the dominant or right hand. Palpate to identify the exact site on the spine where needle is to be inserted, that is L4, L5 or L3, L4 intervertebral space. For preterm neonates, the lower interspace is preferred. Insert the needle held in the space identified just beside the left thumb, using the thumb as a guide for position. Advance the needle gently, aiming for the umbilicus, only so deep as CSF starts flowing out. You should also have an eye at the monitor or pulse oximeter, ensuring the baby is doing fine. Once CSF starts flowing out, it is collected in 3 sterile vials. One vial for cell count requires 0.5 milliliter of CSF. Other vials for biochemistry, that is sugar and protein level estimation, and culture each require 1 to 2 milliliter. Next, pick up a sterile gauze piece, apply it over the LP site just after removing the Ask the nurse to apply a piece of adhesive tape over the bandage. Remove the towels and the drapes. Ask the nurse to reposition the baby correctly on the cot. Continue routine monitoring of the baby. Cardiorespiratory monitor can be disconnected after 1 hour if it was connected for the procedure only. Cap the vials, label them, and document the procedure, including the vital signs after the procedure. Store the sample for culture in the incubator. Remember to send the sample meant for biochemical analysis to the lab immediately. There is one additional but important step to remember before doing lumbar puncture. It is advisable to do a random blood sugar test on the baby half an hour before obtaining CSF. It helps to correlate sugar levels in CSF with that in the blood. Do's and don'ts. Do's. Perform random blood sugar test before doing lumbar puncture. Ensure resuscitation kit available is functioning well. Don'ts. The cot should not be inclined. Do not flex the neck. Do not flex the hips beyond 90 degrees. Do not aspirate CSF with a syringe. Common issues. Dry tap. You may need to rotate the needle slightly to increase or initiate the flow. If you hit the bone, withdraw slightly, reposition and re-advance. If unsuccessful, repeat attempt in next interspace up or down, but never go above the L2, L3 interspace. Traumatic tap. If CSF is slightly blood-stained, collect in one more bottle and discard the first sample later. If grossly traumatic or blood-stained, abandon the procedure and repeat after 48 hours.
Now, we have learned the important steps which need to be followed whenever you are doing CSF sampling in a neonatal intensive care unit. CSF sampling involves appropriate care and a considerable amount of expertise. To ensure optimal CSF sampling, you need to remember that all these steps have to be carefully and religiously followed. Thank you.